Thanks a lot, Ceann Comhairle. Our healthcare system in general is in crisis. We know we've almost 1 million people on public hospital waiting lists. It's even worse for trans people. We have the worst trans healthcare in all of the European Union, according to a recent report by Transgender Europe. We have a denial of services in primary care settings. We have a 10-year waiting list for the public service. Those people who seek to access that through the public service are faced with intrusive psychiatric assessments. We have inadequate care, we have discrimination, we have the exclusion of transgender people from policy development. Actually, the situation is getting worse for trans people in this country in terms of healthcare, not better. People report that it is worse now than it was 15 years ago. We have no national gender-affirming healthcare policy or guidelines, no services for trans young people within Ireland, leaving many in extreme distress. And all of that is in contradiction to the government's own programme for government. And I want to ask a clear question today. Has this commitment in the programme for government been abandoned or replaced? It says, create and implement a general health policy for trans people based on a best practice model for care in line with the World Professional Association of Transgender Healthcare, WPATH, and develop a framework for the development of national gender clinics and multidisciplinary teams for children and adults. Because the very opposite to what is outlined in terms of the WPATH is taking place. That is meant to be a non-pathologised approach to care based on informed consent. But instead, what is happening is a de facto hyper-centralised system in the form of the National Gender Service and massive roadblocks set up to deny people the healthcare that they need and should be entitled to. The standards being applied are in direct conflict with people's rights to bodily autonomy, their right to self-determination and their right to healthcare. To look at that in some detail, take the issue of the waiting lists, because the NGS likes to claim that they have a 3.5-year waiting list, which would be bad enough, but they have over 1,600 people on the waiting list, and they have never handled more than 160 people in a year. It's therefore clear that they have a decades-long waiting list. If you can manage to go through that decades-long, the 10-year-long list, and you don't have the access, the private resources to go abroad for healthcare, what you're faced with is incredibly intrusive, invasive psychiatric assessments. I mean, the things that people are asked, it's absolutely appalling. I quote from you. For over 3.5 hours, my psychological evaluation took place. I was asked about masturbation. I was asked about my parents' divorce. I was asked how I performed specific sexual acts. All of these questions made me feel completely dehumanised. This is a trans woman, says, she asked me about what porn I like, what role I take during the sex, do I prefer men or women, did I play with dolls as a child, did I play sports. This is a 26-year-old woman whose mother was invited and involved, as an adult, no role here whatsoever for a mother here. It's absolutely scandalous. And it starts at a GP level where it's very, very clear that GPs are not being empowered, are not being informed, and in fact are being told that they cannot provide the healthcare that is needed. There's an example of a Ukrainian trans man, after doing all necessary tests and so on, being denied the blood test and the medication that he needed because the GP told him, no, you have to go to the NGS and therefore you're going to have to wait on this long list.
Thank you, Ceann Comhairle. As Minister Donnelly has spoken previously on the topic of gender healthcare and has acknowledged that this is a small and vulnerable group of people who need to have access to proper, appropriate and integrated care, including acute care and community care. He has acknowledged that they do not currently have access to that in Ireland, and he has stated that he is determined to change that. In that context, Minister Donnelly would like to confirm that the HSE has recently appointed Dr. Carl Neff as clinical lead for the multidisciplinary team, who will lead the development of a new model of care under the auspices of the national clinical programmes, and he was delighted to be able to provide €100,000 of funding for the establishment of the team. Now that this appointment has been made, the HSE is initiating a new clinical programme for gender healthcare, and over the next 2 years an updated clinical model and implementation plan for gender healthcare services will be developed. This work will be informed by the best evidence-based clinical care for individuals who express gender incongruence or dysphoria. Now that the full CAST report has been published, it will be reviewed along with other emerging and evolving international evidence as part of this work. There is a clear and well-established approach to the development of this model of care, which, as well as reviewing the best available clinical evidence, will also incorporate input from healthcare professionals, patient advocates and those with lived experience. This is a message that I really want to get across. A key part of the development of this model of care will be the consultation with stakeholders. As Minister Donnelly has said previously, that we cannot have a situation where we are developing a model of care for a group of people who are not involved and whose voices are not heard. Minister Donnelly would like to assure you that the HSE is anxious to ensure that all stakeholders are heard as part of this process. The model of care will incorporate a multi-tiered approach where care will be delivered at the most appropriate level of medical complexity. And while the model of care is being developed, people will continue to receive health care in the community and under the endocrinology service in the adult and paediatric centres in our released hospital group and Children's Health Ireland. In terms of current services, children and young people who require specialist psychological or psychiatric assessment and support are now referred to the Children and Young People Gender National Referral Support Service in the UK, who will triage those referrals to one of the newly developed services in London and Liverpool, Manchester. And this service will work with CHI if endocrine review is required. The adult gender service based in St Columkille's Hospital, Loughlinstown, and provides services for people over the age of 16 years. Minister Donnelly is committed to the development of a well-governed and patient-centred healthcare service for adults and children in the transgender community. Thank you, Oireachtas Corla.
Thanks. The Minister says, and I agree with this, that we cannot have a situation where we're developing a model of care for a group of people who are not involved and whose voices are not heard, that a key part of the development of this model of care will be consultation with stakeholders and so on. He says, this is a message I really want to get across. Better than getting the message across would actually be to do it. This is not what has happened. Trans people have been excluded from all this discussion that have taken place. The HSE, for example, had a meeting on the 9th of February 2023, which was billed as the future of transgender care in Ireland, without a single trans organisation at the table to represent their community. The HSE has unilaterally, you tell me whether the government has agreed to it or not, but the HSE has certainly abandoned the programme for government's commitment to a WPATH-based model of care without any consultation with the trans community. They didn't consult any trans organisations on any aspect of deciding to spend over 1.4 million on a new transgender model of care, hiring a new clinical lead or participating in a clinical study collaboratively with the UK. The Minister for Health actually promised to meet with Trans Healthcare Action, who have done amazing work on this. I hosted a briefing in the AV room recently with them. He promised to meet them 3 months ago, and that meeting still has not taken place. Trans healthcare can be provided well. I mean, we had a doctor from Catalonia at the AV room briefing who provided a picture of 36-day waiting lists. 71% of adults receive HRT on the first appointment. It's based on informed consent. That's what we need to do. We need to have primary care access. We need to inform, educate, empower GPs. So this is a locally provided service, as all other healthcare should be at a primary point. Informed consent, evidence-based practice, community co-production, which is not currently taking place, i.e. real consultation, real engagement with trans people. And this government should be leading on this as opposed to allowing the HSE to abandon their promises.
Minister to conclude.
Thank you, Oireachtas Corla, and I'll certainly take the Deputy's comments to Minister Donnelly's attention. These issues raised during this discussion are very important, and Mr Donnelly would like to know that all of us in this House want to ensure that transgender community are given the proper, appropriate and integrated care and support that they need to live their authentic, fulfilling lives, and I certainly agree with that personally as well. The new model of care will aim to do just that. The development of the new model of care for gender healthcare services is expected to be a complex process, and the HSE and the Minister's Department will work closely together to support the process, ensuring transparency and to keep the patient at the centre of the process. As said in the opening statement, consultation with stakeholders will be a crucial part of this work. I hear the Deputy's comments and I will certainly bring them to Minister Donnelly's attention. However, it is important that the HSE is given time to develop a model of care that is based on the best clinical evidence and that will deliver the best outcomes for persons with gender incongruence or dysphoria. It is not possible to preempt the outcome of this process by determining at this stage what this model of care will look like once developed. The long-term aim is to provide a wide range of services for all people with gender incongruence or dysphoria, from care locally in the community to more specialised and complex care, and Minister Donnelly is committed to building a service based on experience and clinical evidence, respect, inclusiveness and compassion. And as said before and will be said again, Minister Donnelly is committed to the development of a well-governed and patient-centred healthcare service for the transgender community. Thank you, Laskin Corley.